Good morning, everybody. Thank you for joining us for today's Facebook Live segment. Today, I am joined by Dr. Kirk Knowlton from Intermountain Healthcare Heart Institute. Dr. Knowlton, thank you for being with us this morning.
My pleasure. Thank you, Jess.
My name is Jess Gomez, and I'm from Intermountain Healthcare. Today, we're going to be talking about some of the research that is being highlighted at the 2021 American Heart Association Scientific Session, which is virtually being held this year, but some exciting research in terms of heart disease and cardiovascular issues. Dr. Knowlton, we appreciate your time. This is a little bit different this year, being held virtually instead of in person, obviously due to the pandemic. But tell everybody what this meeting is like. The American Heart Association Scientific Session held every year.
Sure.
What's the purpose of it? Who is involved in it, and what's the objective of this meeting?
Right. There are actually a couple of really high-profile cardiovascular meetings that occur each year. Actually, there are two or three, but a couple of them occur here in the United States for all of cardiology. One of them is this meeting here, which is the American Heart Association Scientific Sessions. And it's long been recognized as one of the premier places to present novel and innovative research that's related to improving the health and outcome of people with heart disease, but also an opportunity to present novel scientific insights that may eventually lead to improved outcomes in healthcare. And so that's the purpose. That's the purpose of this meeting. It's long been a large meeting that people could interact and network, but COVID has thrown a little bit of a wrench into that, in that mostly the last couple of meetings have been online. So it's a little bit more difficult, but we're still able to share the research that we're interested in and people find interesting at this American Heart Association meeting.
And this meeting really brings together scientists, cardiologists, researchers from around the globe who are engaging, talking about research and science to learn more about heart disease and ultimately eradicate, which is the #1 killer in the Western world. So really, it's an opportunity for the premier scientists and researchers and clinicians to join together. What have you seen from this year's research conference so far that has excited you?
Yeah, so a couple of things. One is I have an interest in the cardiovascular effects of COVID-19 and how it can affect the disease process and what COVID does to the heart. But maybe I'll jump into that in just a moment. I think there are a couple of other interesting insights that I found intriguing. One of those, for example, we've long known that lowering cholesterol, as we measure by low density lipoproteins, or LDL-C, is a way to help reduce heart disease overall. And so there have been a lot of there's been a lot of movement and research around alternative ways besides the statins to lower LDL. And we have monoclonal antibodies against a molecule called PCSK9, which can dramatically lower LDL by 50%. There's also now some insight into novel RNA inhibitor complexes that can lower PCSK9 and LDL. But both of those are injectable forms of lowering LDL. One has a real advantage in that you only have to take it every 6 months, which is kind of nice. But I think that we were all hoping that there would be an oral form for of treatment for lowering LDL through the PCSK9 pathway. And Merck, the pharmaceutical company Merck, reported some initial studies that show a dramatic decrease in LDL of about 50 to 60% with a pill, which I think could open a new way of treating and preventing heart disease that could be very important for us. Another thing that has caught people's attention, and I don't think it's brand new to this meeting, but again, it was emphasized in this meeting. Some new results were presented that demonstrate a novel way to treat different kinds of heart failure, either when the heart is weak and not squeezing well, or even when it has good function but still causes fluid to develop in the lungs. One is called heart failure with reduced ejection fraction. People that have it kind of know that term probably. And one is with preserved, where the heart still continues to function. But the interesting thing is that diabetes medications were developed that inhibit a molecule known as SGLT2. And the exciting thing is that while they were testing this on diabetics, they saw an improvement in heart disease when these medications were given. And so now they've tested these medications in patients who don't have diabetes, and they still see an improvement in heart disease, particularly in heart failure. So it's really interesting. These are some of the first, not the first, but there are few molecules or drugs that can actually treat diabetes and improve your heart function, but they actually may improve heart function alone in areas where we don't have a lot of therapies, particularly like heart failure with preserved ejection fraction. So I think those are two novel insights that have been evolving over the last year or so, and were presented and highlighted at the meeting that I think give us excitement for the future in trying to prevent heart disease, so that people don't ever have to come to the hospital, or if they've had a heart attack, that we can prevent them from having another one, or we can help them if their heart's not functioning as well, to try to find ways to make it better. So I think those are a couple of things that I thought were exciting to see at the meeting.
These are pretty high level research projects that you discussed, but let's talk about, they all have to do with cholesterol. And what should people know about cholesterol? You talked about an injectable and hopefully an oral pill,
Right.
and essentially the idea is to help people lower their cholesterol. But let's talk about cholesterol for the general population. What should people know about cholesterol, and why is there such an important focus on trying to help people lower their cholesterol?
Yeah. So I think there's a simple kind of headline that or phrase that people ought to remember, and that's to know their numbers to start with. It's important to know your numbers, because if your cholesterol is really high, even if you've not had heart disease yet, it's important to investigate further and try to help treat the cholesterol and bring it down to lower levels. That's really important if there's a family history of heart disease, or other manifestations, family history of people who have very high cholesterols. Then we think we can intervene earlier and try to prevent heart disease in the first place. And then the second thing that's really important is that if a person has had a heart attack or a stroke or peripheral vascular disease, their legs or so, then lowering the cholesterol is even more important. So it's become very clear that lowering the cholesterol in almost all cases is associated with a reduction in heart disease, which is really important. That's why people should know their numbers, and don't be afraid to talk to their doctor about it, because there are a number of different strategies that can be employed to try to help reduce the cholesterol. And the evidence is there that when doing so, we can reduce the risk of heart disease. And some of these novel approaches are now available that don't use statins. Statins are very safe. Statin medications like atorvastatin or rosuvastatin are very safe, but a few people, small percentage, about 9% or 5 to 9% of people complain of some muscle aches with those. And some of these newer strategies don't even have any of that with them. So they're almost, they seem to be risk-free of some of these side effects that people are having. So I think it's important to keep in mind that heart disease, many aspects of heart disease can be prevented by knowing your numbers, your cholesterol, your high blood pressure, your blood pressure, treating blood pressure, and those kinds of things. And that was an emphasis of the meeting too, is novel strategies to treat hypertension and how to go about doing that.
So very quickly, know your numbers. Let's talk about the numbers for cholesterol and for blood pressure. What should people know about their cholesterol? What are the guidelines, and what are the recommendations that people should be in terms of the scope of their numbers?
Right. So ideally, in people who have never had a heart attack or a stroke, we like their LDL. We focus on the LDL the most because that's the bad actor. That's the bad molecule. And we like that to be less than 100. There are other factors like the HDL, which is the good cholesterol. And when that's higher, that tends to prevent heart disease also. But we don't have so many ways to modify the HDL. That's kind of something that you're born with, can be affected a little bit by exercise. So you like that to be less than 100. If you've had a heart attack or a stroke, we like it to be less than 70. And so we treat a little bit more aggressively. If your cholesterol is, certainly if it's above 100, if the LDL cholesterol is above 160, then definitely that needs to be pursued. And there are some people who are above 190, and that may indicate familial high cholesterol levels that is associated with a much higher risk. And that we strongly encourage people to bring that down because that's definitely a treatable kind of disease. So I'd say if your LDL is above 130, seek out some medical advice. If it's above 160, that should keep you awake a little bit at night. And if it's above 190, make an appointment right away.
Yeah, and the way to obtain your cholesterol levels is through a simple blood test, correct?
That's right. A simple blood test. That's exactly right. Yes.
Good,
Yeah.
great advice. Well, let's talk a little bit about some of the Intermountain Healthcare Heart Institute research that's being presented at the scientific sessions. I don't know that a lot of people know, and you oversee this, but boy, your team and the clinicians and the researchers that are involved in cardiovascular research at Intermountain Healthcare, pretty impressive, Dr. Knowlton, and you oversee that team and you publish a lot of work. You're involved in a lot of research, which is just an amazing feat. But perhaps not a lot of people know that that Intermountain Healthcare is involved in this research. Talk a little bit about why it's so important to be involved in the research, not only from your perspective, but from a clinician standpoint in terms of providing care on the front lines.
Right. So just fundamentally, I think that it's, in my mind, Intermountain Healthcare has an opportunity to advance the field of clinical care that's relatively unique. We have a very large population of patients. We have excellent medical records that can help us to learn more. We have great investigators and clinicians at Intermountain Healthcare that help us to address these things. So I think we have, in a way, an opportunity or even a responsibility to help improve the ways that the world takes care of patients, let alone our own patients. So those of us that are highly involved in investigation feel strongly about that we can contribute and have done in the past and continue to do so. So that's one of the reasons is that we have a goal to help reduce and hopefully eliminate many aspects of heart disease. And we feel we can do that as we continue to find the best ways to care for people. But there's also kind of a side effect of, not a side effect, a side benefit of doing research. It helps the institution to stay on the leading edge of innovation and know what's going on, participate in meetings like the American Heart Association so that we can hear what other people are saying and how they're moving the field forward. When we contribute, we have to be on the front edge in order to publish papers and make sure that we say things the way that they should be. And so I think it's really important, one, that we make discoveries that can help improve patient care. That's fundamental. But second, I think there's this benefit that when we're involved in research, that people will know that we are providing the most up-to-date care that can be provided at Intermountain Healthcare. Certainly, that's our goal, and that's what we strive to do. So I think that goes hand in hand with research in many ways.
Once again, an impressive number of abstracts, studies that were accepted for presentation at this year's 2021 American Heart Association Scientific Session. Talk about some of the research projects that Intermountain Healthcare is involved that have been part of this scientific meeting.
Sure. I think one that's gotten a lot of press is that one of our investigators, Heidi May, is very interested in depression and how depression affects heart disease and is associated with heart disease. And it's quite clear that people who have depression have higher levels of heart disease. it's often a little bit hard to say exactly how the depression is causing the heart disease. And there may be some effect of heart disease actually increasing the risk of having depression, but those associations are quite clear that those are there. And we had a couple of presentations at the meeting related to the association between depression and heart disease that I thought were interesting and seems to have gotten a lot of attention. One of the abstracts I thought was particularly interesting was the fact that one of the background first is there are a lot of medications that are shown to improve heart disease, but they tend to be quite expensive. And they can be hard for people to either buy, or insurance companies require prior approval, as you might expect, because they don't want to overprescribe these expensive medications. And so one of the abstracts that Dr. Muhlstein led demonstrated that there was kind of a low use of some of these expensive medications. But interestingly, when people were on these medications, they did better. And so I think that's a socioeconomic component of healthcare that the world needs to figure out a little bit better. How do we get to the point where some of these novel therapies are not quite so expensive, or there's a way that healthcare partners and insurance companies can help pay for those? It's just it points out a problem. It doesn't really offer the solution necessarily, because it's not trivial to find that solution. Another abstract that Dr. Anderson led was on COVID, and whether it's safe to continue some of the medications we use that are called angiotensin converting enzyme inhibitors, or ACE. People know about their ACE. They may be taking lisinopril, for example, which is an ACE, or an ARB, angiotensin receptor blocker, because which, like losartan, is an angiotensin receptor blocker a lot of people might take. And COVID actually binds to ACE2 when it's entering the cells. So there's been a lot of debate about whether taking these medications could be worse for people who have COVID. In other words, when they have COVID, should they continue taking these medications, or should they not? And one of our abstracts, which is also supports a paper that's been published, a randomized trial, shows that it's okay to keep taking your ACE, like lisinopril, and your ARB, like losartan. There are other members of that class, but it's okay. It does not adversely affect the outcomes. And there may be a little bit of benefit of keeping it on in terms of other heart diseases. So that's one of the things that we've done. We're also reported some genetic studies looking at interactions between atrial fibrillation and irregular heartbeat of the upper chamber. That's the most common arrhythmia, the most common sustained arrhythmia that patients have. And we're looking at genetic aspects of that. And Dr. Stacy Knight has done some work and reported some work on that as well. So those I think are important. And then the abstract that I was the lead author on had to do with COVID vaccines and the risk of causing pericarditis, or heart inflammation, pericarditis and myocarditis. And that's a hot topic right now, because people, there's a natural hesitancy to get vaccines. And so some people want to say, the vaccine can cause myocarditis or heart inflammation. And our study and some others that have been reported, a really large population from Israel, for example, which is consistent with our population of, like 1.7 million people that we've studied through the medical record, show that in fact there is a small increase in the risk of heart inflammation that can occur after a COVID vaccine. But what we demonstrated, and others have demonstrated, patients generally is very short in duration. It's quite rare. We showed it in the range of 2.7 per 100,000 vaccines. That's like 0.00, maybe there's another zero there, I can't remember right now, but percent, it's a 0.002%, it's very low. And and so the risk is very low. And then when people rarely get it, they do quite well. And none of our patients have died with that pericarditis. And so I think that, and the important thing is that the myopericarditis there's a much greater chance, like 20-fold or more higher chance of getting myopericarditis if you have COVID and all the other things that go with it. But that's just the myopericarditis, the lung disease, the pneumonia, the pulmonary emboli, the many other things that can happen with COVID when you actually get COVID. So it's very clear that it should not discourage people from getting a vaccine. But if they're starting to have relatively severe chest pain, it's okay to seek out your doctor's advice and see whether it could be something like that. And the symptoms and the disease can be treated. Yeah. So that's one of the things that has been an interesting topic at the meeting.
Lots of exciting and innovative work. I wanted, before we end our visit today, what can people do about heart disease, though? These are exciting research innovation and advancements. What would you like people to know about heart disease, though? Heart disease, to my understanding, is still the #1 cause of death
It is.
in the Western world. But what should we all know about heart disease, and what steps can we take to reduce our risk? What advice would you have for the general community?
Well, I think that the simple concept of know your numbers is a good place to start, that we just talked about in the beginning here. I think also I would advise people, don't be afraid of finding out that you may have an increased risk of heart disease. Sometimes we feel better if we just ignore it and forget about it. But I think I would encourage people not to be afraid. There are a lot of therapies and a lot of ways to prevent heart disease now. So I encourage people to ask the questions. Could I be at increased risk? Is there something I can do to prevent that? Ask your doctor, your primary care doctor, your cardiologist, or any other doctor can measure your cholesterol, measure your blood pressure, for example. A really big thing is, and on that point, by the way, cholesterol is the highest, that's the biggest risk factor for heart disease. Along that point, though, smoking, is just something that clearly affects your heart disease, worsens your heart disease, as well as causing cancer. But so that would be a major thing that people can do is keep an eye on that. Diet is important, and there have been several studies now that have been good studies, randomized trials that look at a diet called the Mediterranean diet. I'm not saying that's the only diet that can help prevent heart disease, but it is the one that's most commonly been shown in good trials to have an effect on heart disease. And it's kind of fresh fruits, vegetables, fish, lean pork, a chicken kind of diet, nuts, etc., that comes from the Mediterranean, as you can imagine. You can just Google the Mediterranean diet and you can see more about that. But in general, you want to focus on lower fat foods, fresh fruits and vegetables, and things that are things of that sort. A colorful diet, some people say, is a good thing to do. And then exercise is always a great thing to help improve your heart condition, keep your body in good condition, which helps to prevent many diseases, including heart disease. And it also provides a healthy mental status, which I think helps us and our heart in many ways also. So those are, and then don't be afraid to see your doctor. Don't be afraid to ask those questions about your risk, and know your family history. Know your family history. If somebody died at an earlier age or had a stent at a very early age or something like that, that should be kind of a yellow flag goes up and says, maybe I should pursue this so that I can be around for my grandkids and make sure that they're doing okay and see all the good things in their life.
Well, thank you so much, Dr. Knowlton, for taking time out of your busy schedule. We know how much you have going on, but congratulations to you and the team at the Intermountain Healthcare Heart Institute for this really important research, for the cutting edge work that you're doing, and for the great care that you provide to the community. It's really wonderful to know that we have such wonderful clinicians, researchers, and scientists who are working to eradicate this major issue of health in our community. So thank you so much. And
Thank you, Jess.
For for joining us on Facebook today. If you have additional questions and want to learn more about heart disease, we welcome you to go to intermountainhealthcare.org, and there's information on the various programs as well as prevention and interesting information, again, to help you live your healthiest life and be as healthy as possible. Again, thank you so much for joining us, and we wish you a good day. Thanks.